You have received the National Award from the government of Germany, from the President of Germany.
Well, I really have to go a little bit back then. I'm an Austrian-born person. I started working in 1970 with called SEM in Kiel, far away yet from the IVF development.
You have been a part of the IVF team who has performed one of the first few IVFs in Germany. You have worked, of course, with Nobel laureate Professor Sir Robert Edwards. So what is the type of challenges you faced when you brought this technology to your country?
That is a fascinating question. We had murder aggression. We were under police protection for 3 months in Kiel in 1981.
And you were also an Olympic swimmer. Tell us a little about that. That's very inspiring.
Well, that shows you that if you like something and stay with it, you can become successful. And as Pierre de Coubertin, who kind of initiated the Olympics, said, it's important to be with it, not to be winning.
Wow. So any particular patient's journey you remember, which sort of touched you, or something you learned from?
So we had patients that went through 10.
Today is World IVF Day, July 25, and a date which is etched in the history of medicine. When the first test tube baby was born, way back in 1978. And to honor this milestone, we have with us a rare and a powerful voice of Dr. Lilo Mettler from Germany, a woman whose life has been nothing short of an inspiration, whose life has been a blessing to her patients. There's so much I can say about you, Lilo. It's such a pleasure having you here in honor of the World IVF Day, which is today. And I want to take a moment to introduce you to the world of your students who already have trained under you, the world of your patients who have benefited from your treatment, from your passion, from your commitment. Dr. Lelo, her journey in medicine has been extraordinary. She's an icon, I must say, because she's been an Olympic swimmer in the 1960s, Lilo, a pioneering laparoscopic surgeon who's worked with Kurt Sem. You have been a part of the IVF team who has performed one of the first few IVFs in Germany. You have worked, of course, with Nobel laureate Professor Sir Robert Edwards, who was responsible for the birth of the world's first IVF baby. In 2022, you were honored with the highest award in gynecology by the German Society of Obstetricians and Gynecologists. And just in Feb 2025, you have received the National Award from the government of Germany, from the President of Germany, for your lifetime contribution to women's health. So amazing, I must say. Congratulations. It's such an honor to be sitting in front of such a legendary doctor and woman like you, Lilo, at the age of 86. She doesn't look 86, but she is 86. You continue to travel the world, teach passionately. That's one of the reasons why you're here in Hyderabad. You have been a part of teaching at an International Reproductive Medicine Congress, which was held in Hyderabad. And so you're visiting us, and you are continuing to inspire the next generation of clinicians, of surgeons. You have so many hats that you wear as well, as a mother, as a grandmother, an educator, and a role model to countless doctors worldwide, Lilo. You also hold multiple doctorates which have been given to you for your work and contribution in this field. And it is truly my honor and privilege to have this conversation with you on this World IVF Day, Lilo. I had to read it out because there was so much about you, and I was so worried that I might actually miss out on mentioning all these laurels which you have gained across your lifetime. And Lilo, we want to ask you so much about, right from your history, your experience as being a part of the team conducting the first few IVF cycles in Germany, to how you have seen IVF over the years progress, develop, and evolve. So, Lilo, my first question to you is, how were your beginnings when you started off? How did you train? How did you know that IVF was a potential treatment to help the infertile, especially when there was so much of criticism to those people who started off doing IVF, whether abroad or whether it was in India? So, what your journey, Lilo?
Well, I really have to go a little bit back then. I'm an Austrian-born person, grew up in Vienna, and at that time, you mentioned the sports. The only sports my parents could afford was go to the public swimming pool. And so I did a lot of swimming, and like this, just the end of my high school time, which was then in Germany, I was in our Olympic team and participated in 2 Olympics in 200 meters breaststroke in the years 1960 and so on. Then I studied medicine in Tübingen, and after finishing Germany, and Vienna, back and forth, and after finishing, I wanted to be a missionary. And I thought it's good to be a Christian missionary. So I went to Peru, but then I found out quickly you cannot be a missionary for a religion. And working in the Amazon hospital there for 3 years in Peru, I just picked up a lot of general surgical knowledge and liked my work there. Then I made an application to Kiel University. My future husband was living there, and I wanted to go there to Kurt Sem, who took just the chair in, you mentioned laparoscopic surgery, but he was taking the chair of gynecology. And he wrote me, if you are coming from Peruvian jungles, I don't need papers, you can start working with me. And I started working in 1970 with Kurt Sem in Kiel, far away yet from the IVF development, and we developed endoscopic surgery. I was in the team there, but I found out quickly that it was difficult for females to get ahead in surgery. So I met at one of our medical meetings Robert Edwards in Japan, at one of the fertility meetings of the International Federation of Fertility Society, the IFFS. And he gave a brilliant lecture on IVF, and I thought I would like to learn that. So I joined for 1.5 years in Cambridge the laboratory of physiology, which Robert Edwards was the head of. At that time, there was not, the first test tube was not born yet, but 10 years of advancement, so to say, of research was there. And I was put on a mouse in vitro fertilization model, which I also carried back to Kiel later and worked on it, and got to know Robert Edwards very well, Patrick Steptoe, who did the clinical sides, and everybody in IVF just had the mission. It's a clinical topic, but it's of course a combined topic of laboratory and clinical work. And the first ectopic pregnancy was in 1976 in Cambridge and Oldham. And then the first test tube baby born in 78, which we are celebrating today. So it was also a journey coming there. Not necessarily that I was convinced that that's the best technology, but I wanted to do something interesting, different than laparoscopy.
Right.
And came back with that knowledge, and that brought me back to Germany. And then also in Germany, I continued to work on it. And it was not easy to develop this technology. In 1981, Robert Edwards and Patrick Steptoe then had the firstborn hall meeting. We were like maybe 20 scientists and clinicians from around the world that gathered, that has worked in the fields, not having had test tube babies yet. There was the one in India from Mukerjee, which also in 1980, I had the honor to learn to know him at a meeting, and then he took us to Calcutta for a meeting from Delhi and showed us human oocytes and embryos. So perfectly understood, but he was not recognized in his countries. They had not believed him that he also had a pregnancy. And it took probably a long time also in India to have that recognized. Well, really this topic fascinated me as much as laparoscopy. So I kept with both of them and tried to carry them on in my professional life.
Wow.
And we were lucky then to have be also under the first ones to have success in IVF. But it takes a long time to reach that. You have to work on it. You have to recognize the oocytes and all this. And at the earlier time, we had no laboratories, no experts. The clinicians were doing all till they understood that they have to hire embryologists. And we had long, long discussions with Bob, who supported me always, Robert Edwards. He got only in 2010 the Nobel Prize for this technology in physiology, which he had brilliantly developed from the 1970s onwards.
So the journey of all these legends started with an idea and courage, because when they started off with this technology, it sounded like Greek and Latin, and it sounded unbelievable. It was not acceptable for many sections of society. And there was a lot of criticism, be it Robert Edward, be it even our own Subhash Mukerjee in India. So what is the type of challenges you faced when you brought this technology to your country?
That is a fascinating question. We had murder aggression. We were under police protection for 3 months in Kiel in 1981. And my son, at 6 years of age, found a bomb under the car. People destroyed our laboratory. All the mice were running out. Everything was destroyed. They thought it was criminal to do these actions, and you were not at all recognized for it. So it was laparoscopy that Kurt Sem was not accepted. Then he jumped on board of IVF as he saw it was running and also supported it. And again, he had murder and the threat, and he was also under police observation. Even he himself never did an IVF, but he supported me, and we had the first test tube babies in the newspaper and like this. So there was a lot of aggression and no exception in the beginning, till the world understood that besides fertility surgery and endocrinology, IVF is bringing another dimension for both men and women to have children if there's a problem.
After all these hurdles, I mean, these are shocking.
Yeah, we never talked about that.
You know, you had to face these shocking challenges and life threats. And what made you not give up when your family and your own life was under threat by the society for whom you have developed and you were working on the technology?
Well, luckily, thank you for the question. We all have love to our family, love to God, and love to our work. And, you know, if one doesn't work, the other one works. Some of the love works. And if all of these three sides work, that's the best. Yeah. And I was lucky that always there was some love there that could carry me along.
And how long did it take for society to gradually accept and allow this technology to progress in your country?
The IVF technology, I think it took like 2 or 3 years, because also in the beginning we were not successful. Now we use simulated cycles. We used at that time only spontaneous cycles of the patient. So the one egg growing in 1 month, to get that in the right moment to fertilize it, all that had to be learned, when to aspirate it, how to aspirate it, when to fertilize it, how to culture it, all this, until we came to the present time of success rate. That took a long way. And of course, with the better success rates, the exception in the open world, of course, was given.
Right. So now we at least have AI. Then a few years ago, we had, of course, Google. We had other colleagues or seniors doing IVF. But in your times, there was nobody you could ask for help, advice on how to stimulate, how to grow an embryo in the lab. So you must have had real difficulties and challenges.
Quickly, national and international societies in our fields popped up. People got together, embryologists, clinicians, found their problems, tried to solve them. So this, I think, mostly carried us, because there's a lot of understanding in the medical community. And then that, also, of course, reached to the outside. But I was resistant over, I would say, a decade before it.
Lilo, just from this short conversation of ours, I've learned that you did not give up when you were faced with terrible challenges. You looked at the bigger picture of having this technology help infertile couples, and you held on when the world was not ready for it as yet. You stood strong, having the few people and your family close by.
Today we have more than 500,000 babies born worldwide around the earth. At that time we had singletons, one in Australia, one in Germany, 2, 3 in England and back and forth like that. And it was laparoscopy that did it, and technology took 10 years. Then we went to the transvaginal punctures that we practice today. So all this took a long time to develop.
Exactly. And even when you started off, the success rates were not that great. You were actually mentioning a while ago that it took you 78 patients to stimulate before you actually
Had a first pregnancy.
had a first
No,
pregnancy.
not to stimulate. We used unstimulated cycles.
Right.
Stimulation was not existing.
Right.
We learned that gradually. The inventions were done in that direction, that you can stimulate the cycle, and then how to stimulate. And then with all the suppression that we need to suppress ovulation, we learned that with all the different methodologies we have today. And but then our professional societies like ESHRE, they came up, they were founded, and we put guidelines, and we could learn from each other. But it's a continuous process, which, as you mentioned, AI and whatever evaluation that we get from thousands of cycles we evaluate, that keeps us going, shows us the right way. We still don't have an individual genetically determined stimulation. That may come someday. So far, there are many, many papers written on it, but we cannot individualize this and this person. We give her the same if they have these criteria. So this will come sometime. Some improvement, as lots of them I foresee still.
Yes. I mean, you have seen the evolution of IVF from its initial days where it was not accepted, where it was challenging, difficult, not so successful. Everybody was still struggling to understand how to do a proper IVF. And now you see it has advanced to frozen embryo transfers, to better stimulation protocols, individualized protocols, pre-implantation, genetic testing, invasive, non-invasive, use of AI, 2D, 3D ultrasound.
There were no IVF centers in the beginning. Now I learned that in India, from the verge of the millennium, from 2000 on till 2025, you went in India. I heard a lecture the other day. From 350, you went to 3,500 that are in India, 3,500 centers in India. And you had only on the verge of millennium 350. So in the beginning, there were no centers. It was in the gynecological departments. We did laparoscopy and aspirated the follicles. And it was not accepted from the rest of the doctors. They said, what do they want to do there ethically? They go around God's decisions, and God decides when we should have the baby. The whole ethics had to be developed daily. New ethics daily we had to develop and defend what we were doing.
And even now, guidelines are developing. There are so many ethical questions being asked. So I think it's a journey which has evolved over these decades.
Correct,
and you have witnessed this entire journey right from the start. And where do you see the future of IVF, Lilo? Where do you see it going? We already are.
I think we cannot see the end of it.
Of course.
And it's developing. And of course, there is stem cell derived sperm and eggs. How is the whole family integrity going to be in the future? This is a difficult topic to assess. But I think it will be easier and easier to help couples that cannot get pregnant to fulfill their wish if we cooperate with different specialties and so on.
Yes. And what about challenges you faced as a woman in this field, Lilo?
I must say in the field of fertility, not. But in the surgical field, in laparoscopy, I felt. But as a woman, I think in IVF, there was from the beginning on no restriction. I mean, we were a small team in Cambridge and Bourne Hall at the time, and there were always females and males with it. So, but in the surgical field, that was different.
Okay. So you faced challenges, be it starting off IVF, being a woman in the surgical field also, you faced challenges. How did you handle yourself? I mean, just as an advice to other female surgeons, laparoscopic surgeons, and upcoming young doctors. What would your advice be to them, Lilo?
I think we should today not think we are female or male in our professional life. Try to be a good doctor, understand what you're doing. In surgery, understand your anatomy and be sure about that. Be sure about up-to-date technologies to use. In IVF, really use all the new guidelines that are coming out and not without thinking, but once you have digested them and see that it's all right, follow it. That keeps you going, and follow your own ethics also. I mean, not necessarily go with the mass. You have to have your own happiness also. I think nobody happy is not happy in themselves. They can be a good doctor. So the personal equality and good life that you try to have with family, with your religion, that is with your country, that is very important as well.
Okay. How do you balance your work and your personal life? Because I know that not only are you very well known in the academic areas, you very actively go and participate in different lectures, you're a part of different societies, you're traveling so much, and as a young mother, how did you manage bringing up your children?
Well, I would tell you now that I am retired from daily clinical work. In Germany, life is easy, and I can easier travel and give lectures and all this. And I still keep practical work in Dubai, where I'm the head of the German Medical Center, and work there just 1 week monthly. So in the previous time with the children and your clinical work and family life, not easy, but possible in our days if you have your line and you see what you want to do. And as ladies in Germany, we had many hurdles to jump. I don't know, in India I see so many ladies ahead, but they have their own hurdles to jump as well.
Yes.
So bringing up children, all this is with the profession well possible if you try to plan it.
And what about your advice, Lilo, to patients? Patients who are going through this fertility journey, who are failing, who may not be having a very good prognosis. What is your advice to them?
So they should understand that we cannot be 100% successful.
Yeah.
Robert Edwards used to say, Lilo, we will be better than human conception. We are better already. We will be, he said, but now we are already better in pregnancy rates with the artificial reproductive technologies compared to human natural conception, if you take a clear cut. But I would tell the patients, be patient, try to fulfill the line, and in a really good percentage, you can reach the success. But if you don't reach it, then know that it's God's will. It's not that we can all decide ourselves. Somehow God wants us to go the other way, and that has to be accepted as well. And we can also find a center in life if you do not have children.
Yes, that's very beautifully said. Very beautifully said, Lilo. So don't give up.
Yeah,
Keep trying.
Don't give up. No.
Be strong.
Yes.
Yeah.
And leave always one line open for something else to come.
Yes. When God closes one door, He always opens another.
Correct.
Yes. Lilo, what did you learn, from working with these pioneers like Professor Edwards? You worked with him for, you said, 1.5 years in the animal lab.
So at that time, IVF was not yet accepted technology, but I understood that it's wonderful that we can create fertilize in vitro. And this in human was not considered nicely. So there's always a good cooperation necessary with veterinary medical doctors. And I learned that this cooperation has to be carried out. If you take example, for instance, the embryo transfer was long time very successful in animals and not in the human yet. The in vitro fertilization was first successful in human and not in veterinary medicine. So that's interesting, shows different specialties can learn from each other.
Lilo, when you moved from laparoscopy to IVF, it took a jump of faith, because the other day I had a question coming in from my colleagues that I'm practicing obstetrics and now I'm thinking of IVF, but I'm not getting that, courage to do that. How did you?
In Germany, we do still not have a specialty for IVF. So it's all in gynecology. So in gynecology, you have to do everything, especially if you want to be a leading director of a hospital, as I luckily was also for a while. So you always had to do everything, but you can put your pinpoints And then you can decide to move out and have a clinic by yourself. Today we have endoscopic clinics that do nothing else but laparoscopic and hysteroscopic gynecological surgery if it's in the gynecological field. And we have IVF centers. But we also still have big centers that do everything. And we have in every department then specialists. So I just had my focus, as I learned it from my teacher Kurt Sem early in life, when we were still also fighting aggressions from people that thought the big cut and the open surgery is better than the small incisions with minimal invasive surgery, that I kept both of those areas going till today. Now, in an IVF clinic, of course, you are with your patients not only during the treatment, they come in between and afterwards and so on. So at the present time, I'm giving advices but not having an IVF clinic anymore. But I still operate in Dubai in my German medical center, difficult cases with my colleagues and my students with modern surgery, robotic surgery, in endoscopic surgery, which allows us to sit and work comfortable without stress if you know how to do it.
Right. And you were also an Olympic swimmer, you mentioned, where
That's was in the child.
Yeah, but then you participated. So
Yes.
tell us a little about that. That's very inspiring that a doctor getting into this field as well. And
well, that shows you that if you like something and stay with it, you can become successful. And in my days in Vienna and later I was 17, we moved to Germany. That was my only sport. So we just exercised a lot. And once you had success, then you were invited for one and the other competition. And you just grow into it. So the longer you put effort in, if you're lucky, you have success.
yes, that's lovely.
And as Pierre de Coubertin, who kind of initiated Olympics, said, it is important to be with it, not to be winning.
Wow.
And in my first participation, we lost by hand touch against the Dutch team at the bronze medal. So I never got a medal, but I met many medalists.
Wow. And then you learned so much from their lives, like how I'm learning from your life. Wonderful, Lilo. Lilo, any patient's journey which touched you emotionally? Because I think our greatest teachers are our patients, their lives. We learn to be empathetic, understanding, listening to their life stories as well. Yes, as doctors, we have the knowledge, we have the scientific understanding of how our body works, about how our technology works, what we can offer to them. But we as doctors also have to understand their journey, because every patient's journey is so unique. Every patient, I mean, just no two journeys are similar. So any particular patient's journey you remember which sort of touched you, or something you learned from, which you can give an advice to other doctors or other patients about?
Well, I would remember a few, but patients have their destinies as well.
Yes.
I think the question goes more how the patient reaches the goal to have a child, to not give up, what they have to go through. So we had patients that went through 10 IVF cycles. That's, of course, a lot. And we know that today, in very few countries, IVF is accepted as an insurance-paid technology. So it costs the patient a lot of money. I mean, if a patient spends all the money and is not successful after that, he could have had 3 beautiful cars for it. It's a sad recognition, but it's given into the life. And of course, I have some patients that died after they have had their children. So all this is something touchy. But I think basically for a patient, we are always sure to tell them that they should envisage the success, but not cling to it, and have something else, have also 2 or 3 lines going in their lives, and they will be successful in one.
Wow.
Maybe a good singer, a good mother, and a good politician. Everybody has to find their life where they are successful. And we have to go with our patients' stories and listen to them and have time for them. That's very, very important.
Very beautifully said, and such a lovely way to end this discussion, Lilo. Thank you for having this
And I wish particularly India, where I see such a big rise in interest in laparoscopic surgery and reproductive medicine, my 2 passions, I see a tremendous rise. And I wish my colleagues on this day of Louis Brown's birth in 1978 all the best. and understand that Louis Brown's birth had at least 10 years of preparation till it was successful. So nothing comes from one day to the other one. It needs encouragement, investment, and duration.
Yes.
God bless you all.
Thank you so much, Lilo. Thank you. I enjoyed every word you uttered during this discussion. It was a learning for me as well. And you are truly an inspiration. Now I know why people call you a legend. And thank you for being on this podcast, Lilo. And I thank you for bringing what you could to this world, to your students, to your family. I think yours is a story of courage, of commitment, of
I don't see
passion.
it flowing better anywhere than in India.
Thank you
India has
so-
picked up so much and lets it flow and float
Thank-
and blossom and grow.
Thank you. Thank you. Namaste. And it's
Namaste.
wonderful to have you.